Hello, listeners. Welcome to Views on Health. Back with us on the program is Dr. Navodha Atapattu, consultant pediatric endocrinologist, Lady Ridgeway Hospital in Colombo. We had Dr. Atapattu speak to us the last time around on childhood diabetes, and tonight on the program, the focus is on growth disorders. A very interesting topic, I must say, because something very uncommon. We don't talk about it or even focus on it in a hurry unless it has actually affected us. If we find somebody within our circle, family or friends, neighbors, within our circle of society, where you find that a child has a growth disorder because it's brought to your attention by the parents or other adults in the family, and then you stop to think, what is this and why is it happening? So I think I should leave it to the expert, the consultant pediatric endocrinologist, Dr. Atapattu, to tell us about growth disorders.
Thank you, Fatima. Right, a child. A growth of a child starts from the conception. So we call it fetal growth. So that is usually depending on mother's nutrition. So after the baby is born, the growth of the baby mainly depends on initial period, mainly depends on the nutrition. And also genetic factors are also important for the growth. So when do we call a child has a growth disorder? If a child is short compared to his or her parents, we call it short stature, and it is a problem. At the same time, if a child is too tall compared to his or her parents, that is also should be considered as a disorder. If a child's growth rate is too fast, if a child is growing very fast, that is again a disorder. And if a child is too heavy, we call it has to be considered under growth disorders, we call it obesity. And if the child's weight is not catching up, we call it failure to thrive. That again is a disorder. So for all these conditions, there are medical issues, underlying medical issues that we have to look at. So short stature means, as I told you earlier, if a child's growth rate is slow or the child's growth is not within the parents' predicted height. So what can be the cause for this short stature? Let's talk about short stature first. Okay, when a child comes to us with a complaint of short stature, first of all, we look at the parent's height and plot the height against the growth chart and see whether the child is actually short. Then we have to find out why this child is short. It could be a chronic disease. Maybe a kidney disease, maybe a liver disease, maybe child is having asthma where the sleep is getting disturbed, or maybe the child is having eczema, again the sleep is getting disturbed, and they are taking a lot of medications for those conditions. Those medications also can affect the growth. So we have to first of all find out whether it is a chronic disorder. Or we have to find out whether actually this child is short compared to the society or the other patients, other children, but maybe within the parents' target height, parents' height. He is following either mother or the father. So that we do not have to worry. It is the genetic potential, and there are certain genetic conditions that run in families that we have to investigate if the child is comparatively very short for his or her age. And it could be a hormonal disorder, maybe growth hormone, maybe thyroxine. So we have to check the hormone levels to find out why this child is not growing adequately. And the other problem could be certain medications that a child is on. Sometimes when children are prescribed steroids for asthma or eczema by physicians or pediatricians, the disease gets cured. What happens is, when the next time the symptoms come, the parents go and take these medications over the counter, and they don't know how much to give. Sometimes they give those medications over a long period of times, especially the steroids. that can impair growth. So one has to take these medications carefully and under supervision. If you tend to take it over the counter without any medical supervision or advice, the growth can get affected. Other thing is nutrition. Nutrition is also important for adequate growth. Carbohydrate, proteins, vitamins and minerals, a balanced diet has to be there for a child to grow, just like a plant. You need nutrition for the growth. And the other problem could be a problem in the bones. We call it skeletal dysplasias. So those patients, at the moment, we don't have a specific medication. It is being studied currently, a new medication. But most of the bone disorders, we do not have a treatment. So they should not be getting investigated over and over again by various different people. It has to be communicated that this cannot be treated and no point in investigating. Those things can be identified through x-rays. So it is a person who is specialized in that area who should find out whether this condition is nutritional, whether this is hormonal, whether this is familial, or whether this is a bone problem which we cannot treat with a special medication. So for that, one has to come on time. And there is a genetic condition, especially seen in girls. We call it Turner syndrome. So those patients, if we give growth hormone early, they can have a reasonable height. What happens is our society thinks it's okay for a girl to be short, but not for a boy. So most of the time when the boys are short, they are being brought for our attention. But the girls, especially this condition, patients with Turner syndrome, tend to come to us around 13-14 years of age when they do not have puberty. This genetic condition is associated with short stature as well as lack of puberty. So only when they see the lack of puberty part, they are being investigated. Had they come earlier, when they were around 3-4 years of age, when they were seemed to be short compared to other children, they should have brought these kind of patients to our attention, because by looking at them, we can identify that particular disease condition, and it is associated with some heart diseases and various different complications. So if they bring the child on time, they can have a reasonable final height. Unfortunately, this group of patients do come only when they are 13-14 years of age. The longer period of time where they could have grown with some hormonal support is lost. So the time lost is, we cannot, we try our best to give other hormonal therapies. We won't be able to achieve a reasonable final height if they come late.
How common is this?
1 in 1,500, according to the world literature. 1 in 1,500 we can see patients with Turner syndrome. So it is an important entity, especially seen in girls. If they come on time, we can give them the best possible final height outcome. They may not be normal height, but a reasonable height. So other conditions like hormone deficiencies also are treatable, sometimes very rarely, and don't get scared me telling this. If they are not growing, if their vision is affected, if they start passing urine more frequently, if they have headache, it could be some problem in the brain, could be a brain tumor even. There were few patients who have come little late who were harboring these kind of tumors. So that also we have to keep in mind, but that doesn't mean all patients who are having short stature should run to a nearest doctor to find out whether there's a brain tumor. There are certain other symptoms that we go through, and also the blood test will tell us whether it is a problem in the pituitary region, which is the primary hormone producing organ in the body, which controls our hormonal milieu. So those conditions are only be those conditions will only be able to investigate if they come to proper medical attention.
Thank you, doctor. So what this means is that in some cases, the parents don't pay proper attention to some of the symptoms or signs that emerge. Like you said, frequent passing of urine or these frequent headaches. And
they all come together. Headache, frequent passage of urine, poor growth.
So
if
then
combination of that is there, we think of a brain tumor, not in isolation.
Right. But I'm saying is if those are there and they still don't pay attention.
Yes. It will.
Yes.
Yeah.
And when you say frequent headaches or even the passing of urine, how would you describe that frequency?
That frequency means they will feel thirsty a lot most of the time, and they will have to wake up several times at night to pass urine. Sometimes this daytime frequency, some people do pass urine very frequently, but the volume is less. That is a habit. But if the child has to wake up several times at night, a person who was dry throughout night, all of a sudden start passing urine at night and had to wake up several times, as well as if the child start bedwetting, all of a sudden you have to see whether he or she is passing a lot of urine, or whether he or she is having inappropriate thirst level. Then you have to, we all think of something sinister is happening, so we can investigate and find out what's wrong with the child. So it's something that people do not see as a problem. And also this frequent passage of urine, headache and short stature, as I told you earlier, it has to come together to think of a brain tumor. So things in isolation may not be such.
Thank you for that explanation. And just going back, the headaches, or the frequency of headaches?
Usually early in the morning, associated with vomiting.
Vomiting does
nausea.
accompany.
Yes.
And so obviously that I think parents would pay more attention to as against frequent passing of urine.
Yes.
But at the end of the day, I think it's very important for parents to take note of every unusual
symptom.
Yes,
or sign,
or a habit that can, like passing urine can be like a common thing that's happening. Headaches, of course, definitely they sit up and take notice.
Yes, headache, usually it is in the morning when they wake up. Otherwise, the migraine headache, daytime headaches are usually due to migraine or stress or excess sunlight, hunger. All these things can cause headache. But in the morning, those triggers are not there. So without any triggering factor, if a child wakes up with headache and nausea and weakness, that is a sign to be concerned of.
Absolutely. Thank you so much, doctor. And taking from there, so what sort of treatment? I mean, you said that you can treat even for short stature to get the optimal height that is possible under the situation through proper medication and care. So what would you do?
Initially, as I told you, we had to find out what is the reason for the short stature or poor growth. If it is nutritional, yes, you have to make sure that the nutrition is optimized. If it is a chronic disease like asthma, eczema, liver disease, renal disease, you have to treat that. And if it is a hormone disorder, then only we come to, after excluding those two, only we come to look for hormones. So all the hormone disorders are treatable. If it is a thyroxine deficiency, yes, we give a tablet and they start growing. If it is a growth hormone, that the growth hormone levels can be checked with a special test, and if our patients are deficient in it, we can treat with growth hormone, and it is an injection that has to be given daily, and it's a very expensive treatment given free of charge. Unfortunately, these days we have run out of growth hormone. That is not a life-saving drug, and we cannot pressurize anybody, or we cannot ask our donors to provide growth hormone, unfortunately, but it will be available in time to come. It was available, and we have been giving growth hormone for the last several years for children who are deficient in growth hormone. And there's another special entity we call constitutional delay in growth and puberty, where usually a boy tend to be shorter compared to the other boys around 13-14 years of age, because that particular child has not gone through puberty on time. Where the peers have gone through puberty, they have had their catch-up growth and reached most of their final height. But there will be a child who is lagging behind this. So there will be a big discrepancy in the height, and this is the time parents most of the time bring their boys to our attention. We call it constitutional delay in growth and puberty. Usually there is a family history. Usually father has had this delayed achievement of the final height in the history. Most of the time. If it is not there, yes, we do investigate to find out whether it is a problem of the hormones. And then after excluding all the underlying problems, we may treat them also with some hormones to expedite the puberty if they are really worried about it. Otherwise, they naturally go through the puberty little late, but they do achieve their final height projected by the parents' adult height. So always we have to compare the parents' height, not the peers' height.
This explains why sometimes we see children of a particular height and you're worrying, especially I see in the case of boys, and suddenly they shoot up.
They suddenly shoot up. And there is this discrepancy between girls and boys, because the girls go through puberty early. So there will be a time where the comparative age girl is taller than the boy. But later on, they do catch it up, and there will be usually there is a 10 to 15 centimeter height difference between boys and girls.
Thank you, doctor. It's interesting because now it explains why this happens, and you wonder, and sometimes you're relieved that he is now shot up, because you always expect a boy to be tall more than the girl. And but now it's very clear
why it happens.
Yes, the reasons behind.
Usually boys start puberty later compared to girls, and they have a bigger growth spurt. I mean, the growth rate is around 10 to 15 centimeters per year during their pubertal growth spurt, and their puberty lasts for a longer period of time. Sometimes you may have heard some people telling you, my son grew till 20 years of age. Yes, that can happen, because if that child has started pubertal growth spurt around 15-16 years of age, yes, that child tend to grow till that time. But if a child has started puberty little early, around 10 to 12 years of age, that particular person would have completed the growth by 14-16 years of age. So the puberty growth goes on for about 3 to 4 years, puberty growth spurt. So if you start early, you stop it early. Pretty obvious. And when you finish your puberty, the growing bones fuse and there will be no more growth. So once the puberty is completed, there won't be any growth.
So that is a sort of a case-by-case situation.
Case-by-case.
Every child is different within his system.
Yes.
And it automatically goes according to that.
Yes.
Nothing that one can speed up or slow down.
Sometimes we can speed it up,
yes.
But it is not always necessary. If the boy usually is worried about it, if he is getting bullied of lack of pubertal signs, we can actually explain the child that you are going to reach this. Do you really want to go through this injection? So if the child really wants it, we can help with, we call it a push start. We give them a small push by giving some injections, 3 to 4 months duration, monthly injection, 3 to 6 months. Afterwards, we stop it and then they will continue that speed. We call it a push start, which is not always necessary. Most of our boys do understand when we explain them. It takes time. Yes, we do explain. Then they then they accept. Most of the time, they accept it.
So, doctor, for the information of our listeners, could you explain briefly what male puberty is?
What male puberty is, right? Male puberty, it's very difficult to see. In a girl, you would know when they start getting periods, yes, the child has started puberty. And also, when they start getting the breast development, you can see it, obviously. But in boys, early stages of puberty is not visible outside. What happens is their testicles start growing in size. We call it testicular volume. We have a special meter to measure the testicular volume. We call it oxidometer. We use that instrument to measure the testicular volume. If the testicular volume is less than 4 ml, we know that the patient has not gone through puberty. If the volume is above 4, which means that the patient has started puberty. It goes on for about 3 to 4 years, as I told you. So it is a very slow, gradual process. Depending on the testicular volume, the hormone levels change. When the male hormones are in the peak amount, they start getting beard, they start cracking voice, and by that time, the growth also they have shot up in their height and reached most of them have reached the final height. So male puberty, when they crack their voice, we know that the puberty is almost done. But you won't see the early stages of puberty in a boy. So that is why parents bring, thinking that this child is delayed. So we have to examine them and see where they are. Not like in girls.
Thank you, Dr. Because I'm sure our listeners would have been happy to hear the explanation so that it's clear in their minds as to what exactly this is as against girl puberty, because that is in girls is very, very clear and very obvious, but not in the case of boys. So just going on from there, Dr. Time is also catching up with us. When we talk about some of the other growth disorders, could you explain some of those to our listeners?
I think I discussed this bone disorders where you look very disproportionate, very, very short. We have this achondroplasia, hypochondroplasia, and there are several other names given for certain skeletal. It comes under the topic of skeletal dysplasia, which means the bones are dysplastic. Bones won't grow as they should grow. So it is one particular condition where we don't have a treatment, but their brain is okay. They don't have any other complication. Just that they are small people. And so that's the other condition that they should know. And the other one is familial short stature. You have to be happy with the parent side, unfortunately. If both parents are short, and the child tend to be following the parents' projected height. It's all, most of the time, growth is a genetically determined entity. So the puberty age is genetically determined, your final height is genetically determined, your color, hair color, everything is most of us is determined by our genetics. Even our behavior is determined by genetics sometimes.
Doctor, actually now there are cases where both girls and boys, but more boys than the girls that I have seen, are far taller than their parents. Parents of an average height, but the boys are much taller.
Sometimes if they have a family member, a grandfather or an uncle who is tall, but this father may be the shortest in that family, but they do carry tall genes. So that is one explanation, and the other one is good nutrition. I told you the nutrition is the most important thing. This father would have had the genetic potential, but he has not had adequate nutrition during the growth period. But the child having the good genes to grow has got appropriate nutrition, reached a better height compared to the father.
Thank you, Doctor. That's a lovely explanation. Thank you so much. So like I said, time is catching up with us, and what will your take-home message be?
Take-home message is, I would like to see patients with Turner syndrome, I mean short girls, little bit earlier compared to what I see now, because we can do something for their final height. So even a girl child can have an appropriate height. Being a girl doesn't mean that it is okay for a girl to be short. Not only boys, girls also should have a reasonable, decent height. If possible, we can handle it, we can manage it if you come on time. So bring your girl if she is short.
Thank you so much, Doctor. That's a lovely note on which we end this program on growth disorders. We're really grateful to you for having explained this particular health issue very clearly to our listeners. Thank you so much, Doctor.
Thank you.
So our grateful thanks go to Dr. Navodha Atapattu, consultant pediatric endocrinologist, Lady Ridgeway Hospital, Colombo, for sparing her very valuable time and expert knowledge to share with our listeners on the program. Thank you, Doctor.
Thank you.
Thank you also to Damayanti Columbage for technical assistance. I'm Fatima Razi Kader saying good night and hoping to catch you next Monday, same time on Views on Health.